Well, as of this morning at 6 o'clock, we have 23 in the house.
4 of those COVID patients are in full to capacity Care Unit 2, or the ICU COVID unit. 17 are now in the recently opened Care Unit 4, and of this morning, 2 COVID patients were taking up the emergency room's only 2 isolation rooms.
It's a serious, very serious.
According to Guam Memorial Hospital Administrator Lillian Posadas, more and more COVID patients that are in need of care are younger. Over the weekend, a 7-year-old was seen at GMH, and according to Public Health Situation Report issued Monday, since Friday there have been 14 new positive cases in the age group between 0 and 9 years old. 17 new cases in 10 to 19-year-olds, 20 to 29-year-olds, 33 cases, and 30 to 39-year-olds, 28 new cases.
So, the mindset of people that, oh, it only attacks the elderly with the comorbidities, that's no longer the case. That's no longer true. This virus attacks any human host, regardless of the age, regardless of your ethnicity, regardless of your class status, or even if you're a professional.
Running parallel to the rising COVID cases is a rising need for space and, more importantly, staff. Posadas saying she's reached out to GDOE to see if they can tap into their pool of school nurses, meeting with the surgeon cell for guidance, and engaging in talks with the private clinic to see if they can get assistance from their nurses. Posadas says on Monday she officially made the ask to the feds.
We submitted a request to the federal government on the medical assignment, to see if we can get some critical care nurses and critical care doctors deployed to Guam. So we're constantly addressing and working these, options for Guam, for Guam's healthcare system.
Right. While the situation is serious and fluid at the hospital, if the positive cases continue spiking, Posadas says the extension of PCOR 1 might be needed.
I agree if it does get extended, because look at the numbers. The numbers continue to increase, and our situation here at the hospital, we continue to be challenged with trying to accommodate everybody, and particularly if they are needing critical intensive care unit level of care. And so, it would make sense, and I think it would be prudent, just again for the health and safety of our community, so that we can get people to that level where they can return to work and be productive in wherever that they work. But we just really need, and the students, the school children, can go back to school. But we may need to extend it, and I support if it does.